Hi Ganesh, welcome to the All About Scale podcast.
Hey, thank you, Willie. Thanks for inviting me. It's a pleasure being here.
Yeah, and I look forward to discussing all things scale with you, Ganesh, today. But before we go into those deep technical discussions, I just want to know what has been your career journey to scale, focusing more on your entrepreneurial flair.
Yeah, no, absolutely, absolutely. With first off, again, thanks and a great job. You're doing a great job on this podcast. So thanks for being really honored to be here as a guest. So my journey, entrepreneurial journey, I guess, started probably very, very early in life. I think my first business was actually an ice cream store, ice cream shop during when I was in high school or middle school, maybe. And I pulled a bunch of friends together, and I didn't lead it, somebody else did it. But we did I grew up in a place called Palghat in Kerala. And
Okay.
every year in November, there's this huge, Rath Yatra car festival, right? And during that time, there's like a lot of people coming in, coming from out of town, and it's a complete, a huge crowd draw, right? So we built an ice cream store for 3 days, and we were scooping ice creams and made a ton of money in a
Yeah.
3 day span as a child. So I'm like, oh, this is interesting. The whole exercise of actually building something from scratch, right?
Yeah.
I did my undergrad in mechanical engineering. Spent 15 years of my career in big tech. I was at Intel and Dell. Did several, I would say, entrepreneurial work within. Like I always gravitated towards the risky stuff that has high risk, high reward kind of scenario. So I was at Intel. I was part of an emerging group. We were building a storage business back in the day, which was non-existent. Intel was a chip company, didn't really build storage chips. So I was part of that. Then at Dell, helped start the Bangalore Design Center in Bangalore for Dell in India, and then went on to actually launch the software business at Dell and this converged infrastructure business at Dell. So several things around that thing. Ended up being a general manager for a pretty large business, and then I was missing building out from scratch again. So I left
Yes.
and founded a company on explainable AI in 2016, way
Mhm.
ahead of the time, but I got lucky. I met someone they were looking for. I met the team at Cognitive Scale. I ended up joining them as their head of growth, sales, and marketing, because they were looking for someone with an operator experience that I had from Dell, but with a flair for building, at smaller scale and growing it from there.
Mhm.
Did that for 3 years, 2.5, 3 years. Was solving AI at scale at that time, and it was very early days of AI, so 2017,
Yeah.
18, and then realized that one of the impediments to driving AI at scale was data and getting the data ready for AI, right?
Yes.
So ended up leaving and co-founding a company called Molecula, which is now called FeatureBase, and the whole premise was, how do you aggregate data from multiple sources within an enterprise, represented in a feature first fashion so you can power decisions very quickly. You can point an
Mhm.
algorithm at it.
Yeah.
So we built an in-memory feature-oriented database called FeatureBase, and it's the industry's first open source, commercial open source feature-oriented database. And so launched that, ran that company for a few years, and then 2020 was this wake up call for everybody, for humanity in general,
Yes.
right? So for
Yes.
me, it was like, look, I've spent all my life helping people shop more and search more with AI. I can do something a lot more impactful than that. How do you drive impact at scale? So, and I'll
Mhm.
distill this down. So founded this company, Autonomize, early last year in 2022. And, I met a co-founder, a wonderful business partner. He comes from a health tech background. I come from a technology background. So we got together and saying, how do we really solve the use of healthcare data across multiple silos that's highly contextual, highly multimodal, and unstructured to drive better human health outcomes, right?
Mhm.
Personalized health, personalized medicine, care access. There's so many opportunities here. And the impediment had been the better way to actually look at the data and
Mhm.
organize it in a way you can power decisions across scale. So one last thing I'll say on the entrepreneurial flair is, like, I think the my flair, or the my interest in entrepreneurship, comes from a few different mental models, right? When one is the high risk, high reward kind of a thing. It's like always an adventurer and everything. Like I try to actually, like, that is the adrenaline rush, right? You
Yeah.
want to go and stuff. And then the second, so do something that is high risk, high reward. You get a few shots in life, just go big, take the big swings. The second part of this is actually more something I learned over time was, and it's very counterintuitive, because as an entrepreneur, you're focused on driving short results, right? Very
Hmm.
quickly, making progress and stuff like that. But one of the most, some mentor told me a long time ago, and I didn't pay attention to it for a long time in my career, but I realized the focus on really long term, if being ultra long term focus is a competitive advantage, right?
Hmm.
And it's actually very core to entrepreneurship. And doesn't mean that you're not focused on what you need to do right now, and you have to make progress. So it's like small gains multiplied, but then always having the eye on the prize, being a really long term focus. So those are some of the I would say my entrepreneurial interest oriented mental models and so forth. And it's very fun when you're actually really small and you're creating things from the whole revolution right now that we're seeing
Yes.
with chat GPT. It's all about creation, right? And
Yes.
entrepreneurship is the ultimate form of creation of businesses, of things of value that people would want, right? So well,
Yeah.
that's my story.
And it has been one fabulous story. And coming to know from you, who has actually lived all bit of it, I think it's phenomenal. And I can, somewhere when you touched upon how to have that ultra long term vision, and that's what, in fact, that excites me as well. That how do people who are leaders into the industry have that kind of foresight? It requires you to be really a visionary in true terms to know that, very long term down in the line, what it would be that would exist and still make an impact. So what are those leading indicators or some kind of mental models that you've developed over time? How does one adopt that?
No, it's a good question. And I'm not any stretch of imagination an expert on this, right?
Okay.
So I'm learning. I'm a student of actually doing this because I was like, I look back at my career, the number of decisions I made optimizing for the short term. I
Yeah.
mean, I'm like, I wish I had known this back then. And I'm talking like when I was in my 20s and I started working in big corporate, right? And like it's always like you're looking for the next promotion, you're looking for the next job, the next big scope, and things like that. And in the process, you're just chasing something without really knowing what you're chasing because the thing that you're chasing keeps moving around. And
Yes.
unless you have the long-term vision, you're not setting that vision for what you're trying to chase after, right?
Hmm.
And it's really hard to do. So that with that premise aside, I think some of the things like just there's a couple of mental models. One I learned from Jeff Bezos, a little read, not very popular book, and I'm forgetting the name, but it's basically a collection of his first 20 years of investor letters, right?
Okay.
That he wrote. There's a couple of mental models there, and one of the things we're very famous. And Bezos is very famous for thinking ultra long term, right? He talked
Yeah.
about that, hey, your next quarter results were set 18 months ago, right? I
Okay.
mean, what you did 18 months ago is the thing that's going to impact your next quarter's results, right?
Okay.
Because you're setting for wrong term. So one mental model is like just really thinking through what doesn't change over time, right?
Hmm.
It's a very like things like human beings, how human beings operate. I mean, like the current, I'll give you an example. The current hue and cry about chat GPT and generative AI taking over and stuff like that, right? Yeah, and there's all this. One example is the one big concern is the loss of jobs and
Yes.
how humans become obsolete. That whole narrative, right? If you think about it at a very core level, humans want to feel valued. They
Yes.
want to create, and they like the drama, right? So you can create math whizzes and robots doing everything, but we'll still kind of get into that place where like those things don't change because that's human tendencies, right? I
Yeah.
mean, like still, and even more at a more core, a deeper level is the fact that humans are always driven evolutionarily by flight and fight responses, right?
Hmm.
Being optimizing for two things as a species. You're optimizing for reproduction and you're optimizing for survival. That's it.
Yes. Yes.
And those things don't change. I mean, it may change over time, but not in our lifetime, right? So how does the world change when what are the things that don't change? Kind of have that as your baseline. And then imagine the world with everything that is changing, right?
Okay.
What can you create a value that'll make a difference at that time? I mean, that's a rough mental model. I'm not saying, again, I'm not an expert at this. I'm trying to live this. I mean, we think about healthcare, right? Like I'm in healthcare and AI right now. It's quite easy for people to, there are even startups getting funded. They're building AI doctors, right?
Yes.
At a core level, healthcare was never about taking medicine and, feeling better. I mean, yes, that's a huge part of it, but it's about care. It's not, it's more about care than about health, right?
Yes.
I mean, in a weird sort of way. And that hasn't changed. I mean, back in the
Mm.
day, how were people treated for their illnesses versus how people are treated for illnesses today
True.
hasn't really changed. I mean, they're using better tools, better medicines and stuff, but there's a human to human interaction. There's a feeling of empathy. There is a level of understanding and assurance and things like that. Which, I mean, yes, you can build models and robots and and intelligent system to go do that, but there's fundamentally there's a human to human interaction or a relationship that is very true to healthcare, if you will, right?
Mm.
So those things won't change, right? So how do you really think about, okay, now with that in mind, if you put the human being in the center of it, be it a patient, be it a physician, be it a caregiver, and you have tools like generative AI can generate content that is original and new, inspired by past content. I have tools to predict outcomes based on multi-structured, multimodal data. How do you surround that against the individual, around the
Mm.
individual, so they make better decisions? So you amplify what you know is not going to never change, but then you
Yes.
make that process a lot more efficient, a lot more fun, right? I mean, so I mean, things like that is, I would say it's a rough mental model, but I think that's one model that I can't even tell you that has helped me, right? Because I'm still figuring that out. But I
Yes.
think that's the way to think about it. I mean, and I believe in that. That's my belief system, right?
Yeah. And somewhere when you mentioned that, taking risky measures is rewarding as well in the end. So high risk, high reward proponent that you are. So when you're saying that think ultra long term or something which is going to make a very valuable impact over the time, which is something largely a constant factor throughout the journey, then what should one do exactly today so that in short term you are able to float yourself up, like you're able to support yourself? So is there a way you can divide the two things, that okay, this is something very myopic, something that I need to do imminently versus something that I'm gonna do like a blockbuster thing?
There's so many things you're unraveling. So I think there's a few things, right? I'll say, like, we live in really privileged times in general,
Yes.
anywhere in the world, even in remote India today and stuff, right? So you're not worried about a tiger jumping on you and eating you,
Yeah.
right?
Yeah.
Think about it, right? So just we're in a privileged world. That means, what that means is, like, and one thing I failed to mention on entrepreneurship, right? The other very practical thing, and I'm trying to relate this back to your question on what do you do today, right?
Yeah.
First thing you have to do is, like, you have to reject fear in the process, and fear is okay,
Hmm.
but you
Hmm.
can't let that drive you, right? So
Yeah.
one mental model that I use to do that is, like, just thinking about and writing down what's the worst case scenario, having a very good comfort level with the worst case scenario, right? I mean, this whole thing, I put all my earnings and effort and time into this thing, and it blows up, right? Doesn't work out, right?
Hmm.
What's the alternative after that, right? If you're
Hmm.
comfortable with that, that already gives you a tool to reject fear to drive your decisions, right? So,
Yeah.
okay, that aside, thinking about long term and operating on the short term, right? It's the hardest problem, and that's why it's hard, right? Because
Yeah.
it's easier to. So there's a few things, right? One is, most folks are not wired to think long term. That
Hmm.
is why you still have climate change deniers, and
Yes.
people are beginning to actually, because they don't see it. I'm like, what do you mean in 100 years the Earth is going to, in another 2050, it's going to go up by 2 degrees warmer, and how is that going to make a difference, right?
Yeah.
That's 50 years, and it's like, people can't fathom it. So it's really hard now. But in that example, now when you're having this mismatch, anybody living in California has experienced torrential rains, and California historically had droughts. There was no
Hmm.
rain, no water. And this year, last 2 years, they've gotten so much rain that there's flooding, there's landslides, and all that kind of stuff that's happening. As an example, right?
Okay.
Now people are beginning to see it because there's evidence of long-term impact being shown in the marketing. Now, how do
Yeah.
you engineer that, right? How do you really engineer that in your journey towards the long term? So one is having, it's always very hard to actually have a lot of clarity, but have some level of clarity and comfort on what the long-term vision is, right?
Hmm.
And then, you know, the short-term one is, you look at it this way, right? You want to make sure that you're continuously making progress towards that vision. I like to actually use two different phrases that I use with my team all the time. One is, I say, small. One is like impatience for action and patience for results, right?
Hmm. Yeah.
You have, so that's one way to think about it, right? One is like you have this grand vision of building a company, an organization that's got the best of the world and the best people come together to solve the most hardest problem in healthcare. That's the, you know, the ultimate vision that you're trying to do. Well, what do I need to do right now? Well, am I recruiting the right people? Am I, you know, talking to the right people? Am I, so those are all things that you have to be really impatient about.
Yes.
Whereas your results that you're expecting, and even in Bhagavad Gita, we talk about this, right? Give up the
Yes.
fruits of the action, right?
Yes.
So the
Yes.
same idea behind this, which is like, how do you really focus on what's in front of you?
Hmm.
There is a tangent on that one, and then like, you know, but without giving up what the future is. And the tangent on the what is in front of you is people don't really give a lot of credence to happenstance or chance in general,
Yes.
right?
Yes.
So we think we can engineer everything. We think we're in control of the things around us. But just
Hmm.
look back on anything that has happened in your life, in my life, right?
Yeah.
How much of that was purely a form of a chance of events that are happening around me, the universe conspiring to make something
Yes.
happen, versus
Yeah.
me really being on the driver's seat and doing that, right? So, and again, the offshoot of that is that what does that mean? Again, back to how do you focus on the short term versus the long term? Think like athletes, right?
Hmm.
Athletes get that one shot to go in and run on that, you know, the 100, like, you know, if you're running a 100-meter sprint in Olympics, right? But you
Hmm.
train a lifetime to get there, right?
Yes.
So you may or may not make that chance on that thing. But if they focus on just, I am not going to go there, I'm going to
Hmm.
get this, I'm not to worry about the politics of how do I get, and all of that goes away. They just focus on the now and focus on training. How do you build the muscle? How do you build the systems? How do you really optimize for the now, and then let the universe conspire to make the future happen, right? So I know there's so many
Yes.
different things I'm drawing from, but I hope that
Yeah.
helps.
Yeah, it does. And I just want to talk more about your grand vision and put focus more on that, which is Autonomize AI, and which is somewhere you mentioned about personalized medicine and the care part of the healthcare that you're putting focus on. So can you share more light on, how do you generate that kind of insights? And generating insights, I think, is still one thing. Doing that at scale, and I assume that the work that we are doing, or maybe you're doing at Autonomize AI, is handling scale, large volume of data, and then multi-model data, right? So how do you do that? How do you enable that?
Yeah, no. So a few things, right? One is, look, we live in a world where health data or healthcare as an industry
Mhm.
generates almost one third of all the data in the world every day.
Hmm.
Yet, as an industry, we're probably the furthest behind in
Okay.
leveraging that to make decisions, right? And what do I mean by that? Well, I mean we've all been talking about personalized medicine. There's pockets of things that are happening, but
Hmm.
is it happening in every care setting, in every medicine that is being developed, you know every care management practice that you're actually putting in place? It's not, right? So
Hmm.
there's a lot of gap between what needs to happen at scale to make an
Hmm.
impact humanity and human health in general versus where things are. So you break that down. Why is it, right? So if you look at anything from being able to deliver individualized care or patient-centric care or personalized medicine or development of drugs that are very unique to certain smaller micro populations, rare diseases, and things like that, the building blocks for making that happen is the data. That's
Yes.
your real
True.
data, real world data, EHR. That's your multi-omics data, so proteomics, genomics, and stuff like that. There's the digital data, patient generated data, digital interactions, patient reported outcomes. And then there's imaging and labs and stuff. So all of these multimodal data.
Yeah.
The problem with that, with all of that data set, it's the three things. One, it's multi-structured and multimodal, right?
Yes.
Really, and it's all optimized for healthcare as the largest employer of knowledge workers.
Hmm.
Most of the data is generated by human beings for consumption by other human beings,
Hmm.
right? To unlock scale, you need to bring tools like AI to do it, but it's not
Yes.
ready for it, right? Because
Yes.
it's multimodal. Second, it's often siloed. It's all in different pockets and things like that. And
Hmm.
third, it's highly contextual data. What
Hmm.
would you see in a doctor's note about a particular patient, the same thing described in a research setting for a clinical trial versus what's happening in a care management's notes, care manager's note in a payer or an insurance provider means totally different things,
Yes.
right? Contextualize that. So the challenges that we see on the data side is how do you solve that whole notion of how do I process multimodal data that are often siloed, highly contextual, extract the relevant knowledge from it, and empower the right person to make decisions with it, right? So that's the core of the problem that we're trying to solve. So we think of this problem as a, how do you build the data and AI powered infrastructure to go solve that? So we call it extract, enrich, and augment. So extraction is all about capturing that data, applying techniques like natural language processing to identify entities, drugs, dosage, diseases, all of the stuff from this multi-structured, multimodal data, biomarkers, and so forth. And then enrichment is about then how do I link all of these different disparate sources together? So you have
Mhm.
techniques like knowledge graphs, you have techniques like knowledge representation and embeddings that can be used to go do that, right?
Yes.
And then once you do that, then we provide a toolkit for which includes your prediction tasks, your generative AI tasks, and so forth that can be used to go solve this problem. So
Hmm.
the grand vision is like it is not going to be, we can't solve all of those problems,
Yes.
right? There's so many things out there. So what we want to do is actually enable an essential layer of the infrastructure. So
Hmm.
health innovators can actually use that to solve this problem at scale faster. So another way to think about it is like, you don't have to solve everything, but you just need to
Yes.
actually find out the fulcrums, right? Where you can
Yes.
create an arch changing impact. Like think of AWS,
Hmm.
as a changing pattern to say, look, earlier for software development to happen at scale, you had to set up your infrastructure, your libraries, your compilers, and the whole nine yards. You had to just spend so much of, and it was not accessible for everybody, right?
Yes.
By making cloud computing democratized and accessible, swipe a credit card, and you can now start using it. They unlock the power of all these millions or even billions of developers around the world to be
Hmm.
able to use it. Think of what's happening with ChatGPT, right? It created a way for human beings from all walks of life to interact with intelligent systems
Hmm.
that today get some questions, but tomorrow can do some reasoning and all of the kind of advanced tasks. So the same thing that we're trying to do, optimize for healthcare data types, right? How do you set up the infrastructure? So not just us, and we'll have to build a lot of these early data products using the platform to demonstrate that it's possible. But then
Yeah.
the way you think about scaling this is like, how do you then build for everybody who's got an idea, who wants to actually say, I'm a physician group network, and I want to actually create a way for analyzing my entire patient population to identify people with certain conditions that have certain behavioral traits, so I can call them and so I can send them a personalized message for taking care of them, proactive care. Well,
Yeah.
instead of one person building that, I want to enable the ecosystem. We want to enable
Hmm.
the ecosystem to autonomize.
Hmm.
So physician network can actually just pull like a bunch of people together, draw the different parts, build that application, and deploy it and get running. And they don't have to think about the technology that is needed to go make that happen, right? That's the
Yes.
way we're trying to get to scale, right? So, and it's a
Yes.
long journey, right? It's not going to happen overnight. It's
Yes.
starting at Autonomize, we were starting with a very narrow space, and we found that the narrow space of clinical data. So just looking at electronic medical records, which is unstructured data, a lot of free text, lab reports, pathology, and all the kind of stuff for different things. So labs and imaging, just combining those two to provide a very rich integrated view of an individual is a huge
Hmm.
value unlock, right? So what we're doing that we're using that to drive better clinical trial recruitment and making
Hmm.
clinical trials a viable treatment option, experimental treatment being a treatment option for rare diseases and cancers and stuff like that. We're using the same thing and helping payers or insurance companies or health systems make better decisions about care and what care pathway to take for a particular patient, because you've now integrated the data, made it available for them so they can make a decision quicker, right? So we
Hmm.
found like we're trying to build these building blocks that can have multifaceted use across
Yes.
multiple types of things. So, and that's the way you drive scale, right?
Yeah.
Um,
That's interesting, Ganesh. And then somewhere you mentioned that, it's like enabling or maybe empowering people to take decisions. And somewhere when you mentioned about chat GPT and people fearing that it would be making humans redundant, and it has applications in wide arenas, right? So it has the power to, I think, eliminate a lot of jobs if done successfully. So I was just thinking that if we are orienting towards the disruption in the healthcare sector, would it be a out and out autonomous system taking decisions, or there would be a human in the loop? Put simply, that would it be like an aid or an ally for people to act in a more informed manner? because you're having a lot many dimensions taken together, and there's a larger view of the entire picture that they can see now as compared to what they were doing earlier. So is it an should I consider it as an ally, or it would be like a lot of healthcare practitioners are gonna fear the loss of jobs?
No, no. So, there are two answers to that question, right? The short, medium term, even a little medium, long term answer is still, it's always going to be an ally or an
Yes.
augmented, an augmentation of what humans already do well. And especially
Mm.
like we earlier talked about, healthcare is more about care, right? It's
Yeah.
about the human connection. It's about, there's a lot of things that's very nuanced in healthcare.
Mm.
Uh, that is, so it's for the foreseeable future is going to be still around, like how do you go and empower the physician or the researcher or the care manager or the utilization manager and payers, make them, give them a Jarvis suit, like an, Iron Man
Yes.
Jarvis, so they can actually do their jobs better, more efficiently and stuff like that. So that's definitely the foreseeable future that we can think of. Now that said, we have seen evidence of how, chat gpt as an example can bring a lot of nuance into the system, right? So you either
Mm.
think about the two extremes. And I was listening to the Sam Altman podcast, and he talks about this thing saying, he made a quick quirky comment and made me think, right? One is Twitter, just with the 140 characters, just took out all the nuance of things. Either you're
Yes.
yelling at people, shouting at people, and it just became like, internet became a really, nasty place to be, right? With the chat GPT's generative text that comes out of it. And if you really think about GPT-4 model that is actually driving chat GPT
Mm.
versus the 3.5, it has brought back so much nuances. You will find that chat GPT-4 is probably the most polite, intelligent agent out there. You can
Yes.
ask anything, show things that it's not like the Sophie from Bing or things like that, right?
Yeah.
Which kind of makes you think, right? Wherein you're seeing evidence that you can capture the human nuance through language models
Mm.
to adaptive intelligence. So that brings the question, in the long term, can you mimic a human, like, and some people call it AGI. That's AGI is a definition problem. I'm not going
Yes.
to go in there, right? But can you really bring in that nuance of how humans interact to add
Mm.
that kind of elements and things into that particular, to an interaction with the human, so that even in healthcare in the future, can you really have an AI doctor to really
Yes.
deliver care exactly or better than how a human being would do it, right? It's very possible, and we are seeing evidence that those kind of capabilities are going to come in the future. But I think, like I said, I mean, if you zoom out and take a look at the problems in the world, we have 8 billion people in the world. We don't have enough physicians. We don't
Yes.
have enough nurses. We have shortages everywhere, and people are falling more sick than they did before. I mean,
Mm.
in general, like, I mean, different things. I mean, it's partially, it's a little, that's a little argumentative, statement, right? But I think we need more help to take care of each other. And if and the human population cannot go from 8 billion to 20 billion, because that's going to cause other issues. um, can AI be of assistance to go make that happen? So longer term, yeah, I mean, I think, I definitely see that AI, as a end of the day, it's a tool. It's a
Yes.
powerful tool. It's a set of tools, a bag of tools, right? And today we're still in the very, very early innings of where this can go. But there's definitely evidence on, you can bring back the things that are very uniquely human. We started with creation of original content, which was, you know, human beings always thought it was all for themselves and only humans can do it. And now all of a sudden, everybody was like, holy crap. I mean, you can do it with an AI, a generative model. So that kind of thing can come into other walks of life. But I don't see that happening anytime super soon. But I think even
Yes.
if it happens, I think, it just the mental model on this is like, look, I mean, it's the almost you now have tools to do the things, to choose to do the things that you really want to do,
Yes.
right? If you're a doctor, and if you think about an American doctor today, 60% of their physician's time is spent documenting and retrieval documents from the
Yeah.
electronic health record system, right?
Okay.
It's just a sin to make that happen. 60%,
Yes.
right?
That's gross.
And I offload that to an intelligence agent that can capture the
Mm.
nuance, I do it and update it and retrieve it and things like that. Absolutely huge opportunity. So I
Mm.
think this is the thing. And is that are doctors going to be replaced by AI? No, but if doctors who don't use AI may be replaced by the doctors who do, right? And that was
Yeah.
not my, it was actually somebody at Stanford Medicine who made the comment a few years ago. So I think there's all possibilities out there. Let me ask you a question, right? We were
Mm.
talking about some stuff. There is the 2 days ago, 3 days ago, there was this there's this letter being sent around for signatures on
Yes.
pausing all the anything greater than GPT-4 experiments for a period of 6 months for regulations and bodies and peoples to catch up. What do you think of that?
In terms of why we are doing it now, why we didn't think of it before.
Or should we do it? Should we not do it? Is pause a good thing to do? Happen right now? Is it going to stop progress? Is it going to help anything? I mean, just give me your sense of what you think of it.
Yeah, I think there are both sides of it. One is that, why is it coming as an afterthought? Most of the things that I keep asking people is that, a lot of development has happened till now, and now we are kind of raising these concerns. I think these things would have happened before. And considering that I'm following AI ethics for long, I still feel that, yeah, this is coming at a later stage. Now, coming to the implications and the concerns that people have, leave aside that we are a little late in the journey of pausing it. The pausing, I think, looks like a little, like, I'm not speaking on either side's behalf, but pausing looks like a little too aggressive a step. I don't know what we are trying to stop. It needs to be quantified. It needs to be clearly laid down that we know these kind of harms can happen and we want to regulate it. And if not regulated, right, if left unregulated on its own, what kind of damage do we see it to bring it to humanity? Because like one point that you mentioned, that overall, when we see a long-term vision of healthcare, it's a super long vision that I see that there would be a potential chance of it replacing doctors or something, right? But in the imminent near term or even to the middle term, there is a lot of inefficiencies that need to be weed down upon or acted upon. Somebody needs to fill in that gap, right? So that's what I want to see, that if if we use AI, like when you mentioned the doctors who use AI, they are going to improve the overall healthcare system. So it's for the benefit of humanity. But if we are leaving this part of ChatGPT or the LLM progression, if we leave it unattended, what exactly is gonna lead to? So having both the visions in mind, I think overall, if our objective, what we are trying to optimize for, is that the benefit of technology on the society overall, if it is towards that, then these kind of measures are totally called for and can be taken and done that. Leaving aside that how late we are into doing this today.
That's fair. No, it's
Okay.
fair. No, it's actually interesting. It's fascinating. I've been trying to think through, like, I don't have an opinion on either side because
Yeah.
I'm really trying to understand the arguments on either side. And
Yeah.
the one hand, I can see the pace at which we're in that exponential curve right now, right? So,
Mm.
the last 5 days, there's been like 20 different models that have been launched. There's sort of
Mm.
sister models and things like that. So a lot of progress in the research, which means that technology is now available for access for anybody, good actors and bad actors. So I can
Yes.
see that argument saying, look, you don't have the checks and balances in place. So put that in place before we do it. So, but pause it, right? Now, is a pause going to really do what it's supposed to do? Don't know. Will that pause means you can now be more complacent for another 6 months before you figure out what to actually do about it?
Yes.
Don't know, right? Because it's like saying, hey, don't do that. And then, okay, then what do I do? Well, I
True.
haven't thought of that yet, right? So
Yeah.
it's like that thing about, but I do agree that we're definitely grossly unprepared for where we should be, like with this revolution on it. And you and I have been in AI and ethical AI for some time, and we've been
Mm.
thinking about it, talking about it. I think we all didn't do enough until this point, right? I mean, like,
Until this point. Yeah.
or people. I mean, you can always blame people didn't listen, people didn't do enough, but I think the reality is we as a human race should, have seen this moment. And,
Mm.
there's a lot of folks in research who've been calling this moment for a while. And even now, right, the debate is so, there's folks who are, the reaction is not to say, I know a lot of folks, dear friends of mine too, who actually say, oh, Chat GPT is not really that, just a
Yes.
tool. They're the same guys who are arguing you should pause it.
Yes.
And that to me is like really hypocritical, right? And then
Yeah.
I know what they were trying to do. They were trying to diminish the fears of it, like, kind of stuff. But then all of a sudden you have to do something practical to stop the progression or pause the progression, if you will, until you get prepared. So, but it's that mixed messages. It's that, and that's the human drama that I was talking about, right? You need that as a
Yes.
species to survive, right? If, anyway, if we live in, even Brave New World,
Yeah.
Audrey Huxley's, I mean, it was a revolt, right? So it's not that much fun. Anyway, so anyway, we go on a tangent, but
No,
thanks for your
but
thoughts.
yeah, and I kind of agree with that pausing it is one thing, that but are we really sure that at the end of 6 months we'll reach to certain conclusion that after that it's acceptable to keep building such models and using it or releasing it to public domain? That's also not clear, partially because history doesn't speak for itself, right? So
Yeah.
there's not that you've seen in the historical past that everything was talked upon. Then some people were saying let's make ethics as a service, then how to operationalize ethics, and these things are still so abstract, so esoteric, that it's difficult to know and foresee that given the stance that we take today, what situation will we land ourselves in 6 months down the line? So I don't know what it's gonna lead to, but yeah, I know that there's people standing on both the sides, and hence I'm also kind of staying away from making any stark one-sided conversation. But let's see what it's gonna lead us to.
Yeah, no, we at a minimum we all live in really exciting times,
Yes,
right? So
that's true. Yeah. And somewhere when now that we are talking about ChatGPT on that line, when you started Autonomize AI, you must have certain vision. Like I work on the AI strategy side, which means that you at least have certain for vision for 2 to 3 years, and then that's how you build the foundational work. Coming the top up of these technological disruptive advancements from 3.5, 4, and all things, how do you see and how do you course correct yourself, and do you change your vision, and do you think that okay, let me also kind of tap onto this and ride onto this wave?
no, it's a really good question, and it kind of goes back to your long-term vision and short-term.
Yes.
What do you do, right? I think a few things, right? One is a sound vision is something, like I said, you focus on things that don't change, right?
Hmm.
So for us, like what we're trying to do is like, how do we really help innovators or anybody in any walk of life make better decisions with health data,
Hmm.
right? Drive power outcomes. That vision hasn't changed. It's still steadfast from the way we started, right? We used to call out like we want to be the snowflake for healthcare, right? To help organize the data so people can make decisions like they did for other industries. I mean, and that hasn't really changed, if you will. We're still trying to get to that thing of building a platform for actors to make decisions on health data to power better, positive human health outcomes. So then comes and then you put a roadmap in place on how you're going to get there, right?
Hmm.
Now, if anything, what happened with the publicly available models and because of ChatGPT, the research being out open sourced, and there's a lot of progress that are happening, is it accelerates that vision, right?
Yes.
So you look at these things as a way to tool. I'll give you two very specific examples, right? We were using our own homegrown. So we have a clinical large language model that we built, and it's optimized for looking at EMR data, a few different modalities of data to understand drugs, diseases, dosages, medications, the relationships, time series relation, all of that stuff from text, right?
Hmm.
Which is great. Our roadmap had the ability to the ability to look at imaging data and extract the biomarkers from it and turn
Hmm.
it into text into this thing. That was our original plan. Well, we didn't have to build any vision models anymore. We
Yeah.
have the image to words, image to text kind of models that are now open sourcely available
Hmm.
that we can leverage, and we're now training it and retraining it or fine tuning it for certain image types and so forth. But that part of the roadmap just got accelerated,
Hmm.
right?
Yeah.
So I mean, back to the thing about like we started with a very ephemeral vision of something that doesn't what we have to go impact and affect, and
Hmm.
all of a sudden the universe awards us with all these latest tools that we can plug in, right? And to
Yeah.
make that. So one is that part. The second part of this is actually, there's definitely a value, commercial value in capitalizing on a hype that is happening, right? We're
Okay.
being very careful because if we were in retail or any other industry, we would have
Hmm.
just jumped all in on it.
Yes.
So there's a lot of, you know, tension within the teams saying like, look, we're doing a lot of generative tasks, so we should say we're generative AI for healthcare. And I'm like, what does that even mean, right? I mean, like,
Yeah.
it depends on like what meets your goals versus that. But I think I'll tell you one thing that we're not I'm not going to pre-announce it, but we're thinking through is launching a toolkit to leverage all of these openly, freely available capabilities, which everybody wants to play with, be it a GPT-4 model or a DALI model or stable diffusions, or some of what is the anthropic models and so forth, there's everybody wants to play with. Well, can you help them have a playground to play with it for healthcare specific data, keeping in mind their needs, their wants, the prompts, all of that kind of stuff, and create an environment for them to play with? We're thinking through that. I think, yeah, maybe that's a way to add value to an end
Mm-hmm.
customer, because they want to experiment, they want to play, they want to see if it's actually done. But it's way far from where they want it to be to what it is today, right? Can you bridge that gap? So you're adding value while capitalizing on the movement that is happening, right? So
Yeah.
it depends on what you're trying to. If we were like honestly, if we were like a 5,000 people company and we were like a later stage, a public company, and I have the pool of dollars available, then yeah,
Yeah.
obviously I would probably go launch a new product set or an offering set. But we're early stage, and we're like we're focused on our early group of customers, make sure they're
Yeah.
leaving fans of ours incredibly happy. Meanwhile, just expanding our TAM to go into customers where we think we can very wholly go and impact. Because it's important as an early company to add value in a very exponential fashion, right? When they put in you have to give them 10 or 100x return for their investment in you, right? Because that's what makes them fans, and they actually talk about you to other people, and you build out that particular feedback loop and stuff like that. So we're
Yeah.
very focused on our early stage, but yeah, it is like it's tempting for sure, and to just go and take a hype and go run with it, but not losing sight of that long-term vision and looking at this and say, okay, now I have new building blocks. How can I use it to go power our
Yeah.
existing that we're already on, right? And in some cases, you'll have to change, right? I mean, I'm not saying that that's going to be possible for everybody. Somebody who probably started, building machine learning models to do insights on marketing content
Mm-hmm.
has been completely rendered irrelevant right now. They don't
Yeah.
need to do that,
Yeah.
right? So they have to pivot, they have to change, and so I think it's very. I'm not answering for everybody, but I think in our view, it's like, look, we're very focused on our core vision and mission, and we think we can actually impact change. And all of a sudden, you have more toolkits
Yeah.
available to accelerate your journey to that mission. So that's how we think about it.
Yeah. And Ganesh, continuing our thread from that responsible use of AI, I have spoken on this about this on multiple forums that these are high impact areas, healthcare, judiciary, and maybe finance domain, right? So considering healthcare as a topic of discussion today, one of the things that you must have also observed is the adoption. So there are a lot of stakeholders in this process, right? The maybe the healthcare practitioners, they have to agree and maybe consent that yeah, we think there is a value. So how do you convince somebody that there's a value in this? The inefficiencies, like initially maybe just speeding about inefficiencies and making them take a better decision, and then to the end, maybe a patient or somebody who is actually in need of those services by personalized recommendations, for example. So how do we build or instill that trust into the ecosystem so that all the stakeholders are convinced with what they are getting themselves into?
Yeah, the simplest answer, and it's simple to say it, very hard to pull off,
Yes.
is you co-create with them, right? So
Okay.
you co-create with them. You actually bring them into the process of actually building these capabilities. And one way, and like for us, it's actually a very fairly easier problem than a lot of the other companies, right? A lot of the other folks in the space, mostly because we're actually focused on building the building blocks so they can build
Yeah.
the outcome we're trying to do, right?
Okay.
I'll give you an example. I gave you an earlier example, but we do one of our very popular piece of capability that we built was, given a clinical trial eligibility criteria,
Hmm.
you can point me to a database of patients, and I can give you the best match of patients
Hmm.
that are most eligible to be participating in the trial, right?
Okay. Yeah.
A lot of our customers use it. It's a very, it works very well. But the way we actually have to think about it is like, look, you can't say that here is the patient who will absolutely be a great fit.
Hmm.
The other side of AI or intelligence is design, right?
Yeah.
So we actually built a product design in a way saying we truly tried to make it a recommender system to go
Hmm.
in and say, look, here is the first 25 patients or subjects you have to review the notes of,
Hmm.
right? Make sure that they're, I think we believe, the AI believes there's 90% confidence that these guys are the best fit. And here's the evidence, right?
Hmm.
And that evidence could be here are the diagnoses that are confirmed in their documents, and you click on it, it opens up and shows them the evidence of the source document, shows them provenance. So you're immediately building a trust equation with them, saying, okay, it's my decision, not the AI making a decision for me. It's making a
Hmm.
recommendation. So there's a
Yes.
design element of that. And then if I get something wrong, and be truthful about it, just like ChatGPT does today, right? We have a reinforcement learning framework where you
Hmm.
actually go and you put in that comment. Now we're not doing it in as human in the field, reinforcement learning with human feedback yet, right? So
Hmm.
we'll eventually get there. I think that technique is getting there, but we're capturing that feedback to look at the annotation that was done. If you need to fine tune the model to based on that, we go that make that change back, get it back into the deployment. So things like that, where you it's a combination of how do you design an interaction with the intelligence system, human machine
Hmm.
interaction, in a
Hmm.
way that you're not purporting that this is actually this is the answer to go take it. And
Yes.
that's when
Yes.
people completely distrust us, right? You respect the fact that the human is the expert here, and you're
Hmm.
just helping mine the data to get the recommendation, get to the point where they would otherwise have gotten to after 5 days, right? So you
Yes.
give them that kind of experience. That's one. Second is you put in a lot of fundamental capabilities around, like, we don't do anything that's not explainable, right? If it's
Hmm.
a black box that you cannot provide evidence of a decision or a prediction or a recommendation, we don't use it. I mean, there are cases that we could do it, like, just, but we don't do it because, I mean, it's a very high stakes environment to go do that, right?
Hmm.
Then doing the basic compliance, provenance, that kind of stuff to put in there, where you can, start making sure that you can always dial back all the way down to the source data, what led to the decision, what was the training thing, capturing that entire chain of things. That gives confidence mostly to the technical stakeholders right now in our
Hmm.
customer set, but it kind of gives a very it gives the comfort for the
Hmm.
user, physician, or the medical directors who are looking at this too, right? And then so there's a combination of, I would say, like, you have to do a lot of technical things like explainability, provenance, compliance, all of that kind of stuff. You'll have to do a lot of design work, which is about making sure that the human machine interaction paradigm
Hmm.
is very solid, very sound, very, in a weird sort of way, very nuanced and humble, right? You're not
Hmm.
going to say, like, this is the answer, go take it, run with it, right? So you got to
Yeah.
do that. And then I think you have to cover it all up with some education as well, which is still, I
Hmm.
think, be lacking.
Yes.
People think, like Chat GPT can be used for, I can just use Chat GPT to get a summary of my medical charts. I'm like, as long as you don't care about that data showing up in somebody else's spreadsheet when they're trying to build synthetic records for something, right?
Yes.
Because it's not HIPAA compliant software. There's a lot of these nuances. So there's all these things that people don't really understand very well, and it's all nuanced
Hmm.
things. This education, human machine interaction, experience design, and the technical capabilities around, getting the basics right, provenance, explainability, and so forth. So I think that's the way we're thinking about how do you build trust with your thing. And if you can direct this in a way that you're co-creating these solutions with them, even better, right?
Yeah, yeah. No, that's very well put. I think explainability, like, I think you have expertise in explainability, having your previous, venture into this. So I think, Ganesh, it was a great conversation. With this, we've come towards the last section of it. And, thank you so much for taking the time to come to the show.